Take a moment to think about eating your favorite meal with your loved ones. We all have pleasant memories connected to food, as eating is paramount to nourishment as well as to build and cultivate social connections. So what happens when someone cannot swallow safely and efficiently anymore? A condition called oropharyngeal dysphagia. Oropharyngeal dysphagia has a global prevalence in the general population comparable to diabetes and represents a chronic symptom among head and neck cancer survivors and people with neurodegenerative diseases, with prevalence expected to rise in the following years. Systematic reviews highlighted that reduced health-related quality of life is associated with increased oropharyngeal dysphagia severity and with broader dietary restrictions used to eat safely. Given the extensive importance of enjoying food for our lives, may chronic oropharyngeal dysphagia impact well-being too, which refers to how satisfactorily and meaningfully people live their lives. Evidence suggests that humans can adapt to and live meaningful lives beyond chronic health conditions, but we do not have data on people with chronic oropharyngeal dysphagia. Also, is swallowing alone associated with health-related quality of life and well-being, or are limitations in the ability to consume meals and nutritional status involved? Are informal caregivers who support patients throughout their daily challenges affected by oropharyngeal dysphagia? To answer these questions, I adopted a threefold method. First, I performed a scoping review to map the care needs of people with oropharyngeal dysphagia and their informal caregivers. I found that care needs are multifaceted, with social and practical ones most frequently reported. Secondly, a qualitative exploration confirmed the multifaceted nature of care needs among people with chronic oropharyngeal dysphagia and their informal caregivers. Besides, patients and caregivers described coping with practical problems and attributing meaning to their experiences. Finally, I studied the associations of swallowing function with nutritional status, meal consumption patterns, health-related quality of life, depressive symptoms, and well-being in 57 patients with chronic oropharyngeal dysphagia and 37 informal caregivers. I found that limitations at mealtimes were pivotal, as they were directly associated with oropharyngeal dysphagia severity and indirectly with nutritional status and health-related quality of life. Conversely, well-being was independent of clinical and functional measures. Patients' and caregivers' subjective experiences were interrelated. Thus, to provide quality care for people with chronic oropharyngeal dysphagia, clinicians, researchers, and healthcare managers need to look beyond the swallowing function and promote empowerment through family-centered care approaches.